I'm a physical therapist here at Loudoun Sports Therapy Center, and I'll be talking to you a little bit today about beginning an exercise routine and what some of the essentials are. So we'll start at the top with the warm-up. So some of this is obvious to most people, but some people forget the warm-up and exactly what the warm-up is supposed to entail. So according to the American College of Sports Medicine, they recommend that there's at least 3 to 5 minutes for a warm-up, and it should include dynamic movements, which means it's something where you go through a large range of motion, like for example a high knee or a jumping jack. And then the next thing we'll talk about is the second part of your main exercise program, which is the resistance training. So resistance training ideally should be done according to the ACSM guidelines about 2 times a week, and this should include all major muscle groups. So the next thing we'll talk about is the cool down. So the cool down is extremely important as well as your warm-up, especially if you're somebody who has heart problems or may not be in the best of health or has some other cardiovascular issues. These will be extremely important for you in order to get your blood pressure and your heart rate back down to normal after vigorous or even moderate exercise. In general, your cool down should be very similar to your warm-up in that it would be about 3 to 5 minutes, and it should also include more dynamic exercises, but a little bit slower paced. So instead of doing your jumping jacks like you're getting ready and pumped up for the workout, you can go a bit slower and really slow down your breath and take deep breaths and think about, this is your wind down, this is your cool down. I'm going to get ready to go back to my normal day after this. So you want everything to be a bit slower and more controlled.